Welcome students to our new YouTube channel Pharma Extech, the division of excellence. So we start the new chapter from cardiovascular system, which is anti-hypertensive drugs. So what is anti-hypertensive drugs? So we divide this anti-hypertensive in three parts. So first is anti. This anti means to prevent, and we use in our daily life anti-rogue gel, and you know the words like anti-diabetic, anti-hypertensive, anti-hypolipidemic, anti-arrhythmic, and this anti-hypertensive. So the next hyper. So the hyper means the increase in your blood pressure or increase in your heart rate or increase in your any other activity. So there is increase your activity and blood pressure. And the next is tensive, and this tensive words describes the your tension. That means due to hyperactivity your tension is also get increases, so there is increase in your tension. So these anti-hypertensive drugs are related to the blood pressure. So let's see the blood pressure. So the blood pressure is given by the two parameters. In that, first one is cardiac output, is given by the rate and stroke volume of the heart, and also the total peripheral resistance. This total peripheral resistance is given by the blood volume and the level of vasoconstriction. And also this hypertension is a pathologically increase the blood pressure due to an increase in any of these parameters. So simply this hypertension is the increase in blood pressure due to increase in any of the parameter. That means increase in your any other activity. That means you take any load, and after that you have just increase your blood pressure, so there is hypertension. And the examples, like if you see the heart patient, that means the person which has congestive heart failure, the heart attack comes in a quick, then the person is died due to heart attack. So this hypertensive action is very quick and fast. So these are anti-hypertensives. So next we see the drugs. In that we first see the direct vasodilators in the anti-hypertensive drugs. So these direct vasodilators are these vasodilators dilate the blood vessels and thus decreasing the total peripheral resistance. And also next we see the calcium channel blockers and also the others anti-hypertensive drugs in emergency or urgency. That means in extreme cases the anti-hypertensive drugs use. So these all drugs types we see in this anti-hypertensive drugs topic. And also at last we see the classification of these anti-hypertensive drugs. So there are 4 videos on this topic, so please stay tuned with Pharma Extech. So we are at the direct vasodilators. So these direct vasodilators dilate the blood vessels, thus decreasing the total peripheral resistance. And the direct vasodilators are minoxidil. And let's see some general points about this minoxidil. The minoxidil is activates the potassium channels and thereby thus causing the outflux of potassium. And also this minoxidil leads to hyperpolarization of the cells and following the vasodilation, and this minoxidil is a strong and long acting vasodilator, and this minoxidil is administered by intravenous route. So next we see the uses of this minoxidil. Minoxidil is used in the last resort in the treatment of severe hypertension, and the side effects of minoxidil includes the reflex tachycardia, increase the blood volume, that means activation of the renin angiotensin aldosterone system, that means RAAS, and also hirsutism, that means increase the facial and body hair growth. So the next direct vasodilators is drug is hydralazine. Then so we see the some general points about this second hydralazine. The hydralazine inhibits the calcium release from sarcoplasmic reticulum during depolarization. Thus this hydralazine leading to the decreased vasoconstriction, and the hydralazine is administered by intravenous route, and the tablets hydralazine hydrochloride 25 mg and 50 mg are available in the medical store and market, and also it is in the form of injection in powder for solution for injection. That this injection name is hydralazine hydrochloride injection, and also this injection is available in 20 mg ampoule. So next we see the uses of this hydralazine. The hydralazine is used in the combination therapy in moderate to severe hypertension and also hypertensive crisis, hypertension associated with pregnancy, including preeclampsia or eclampsia, and also the heart failure. So in heart failure, this hydralazine is used. So next we see the contraindications of hydralazine. The contraindications are idiopathic systemic lupus erythematosus, severe tachycardia, high output heart failure, and also the myocardial insufficiency due to the mechanical obstructions, and also the dissecting aortic aneurysm, and also the porphyria. In these all cases, the hydralazine is not used. So next we see the precautions of hydralazine in hepatic impairment and renal impairment, the reduced dose, and also in coronary artery disease, in that they may provoke the angina, or this drug is avoided after myocardial infarction until stabilized, and also in cerebrovascular disease, check acetylator status before the increasing the dose above 100 mg daily, and also the test for anti-nuclear factor and for proteinuria every 6 months, and also in pregnancy, breastfeeding, and also occasionally over rapid blood pressure reduction even with low parenteral dosage. Then next we see the dosage of this hydralazine in hypertension and dry mouth, and the dose for adult is 25 mg twice daily, and increase if necessary to maximum 50 mg twice daily, and in hypertensive crisis including during pregnancy by slow intravenous injection, adults 5 to 10 mg diluted with 10 ml sodium chloride 0.9% if necessary may be repeated after 20 to 30 minutes, and hypertensive crisis including during pregnancy by intravenous infusion, and in adults initially 200 to 300 micrograms per minute, maintenance usually 50 to 150 μg per minute. And the side effects of these hydralazines are same as minoxidil and SLE like disorder in autoantibodies against own DNA. And the last drug, this is direct vasodilator is the nitroprusside. So let's see the some general points about this nitroprusside. So this nitroprusside is the inorganic nitrate, and this administered by intravenous route, and this is same as organic nitrates. And this sodium nitroprusside is a complementary drug for the treatment of hypertensive crisis, and this drug is available in infusion form, that means the powder for solution for infusion. And this sodium nitroprusside and this in 50 mg ampoule. So this nitroprusside in injection is sodium nitroprusside powder for solution for injection, and 50 mg ampoule is available. So next we see the uses of this nitroprusside. Nitroprusside is used in hypertensive crisis, that means when treatment by mouth is not possible, then nitroprusside is used. Then next we see the contraindications of this nitroprusside, and contraindications include severe hepatic impairment, compensatory hypertension, severe vitamin B12 deficiency, labor optic atrophy. And the precautions like in impairment pulmonary function, hypothyroidism, renal impairment, ischemic heart disease, impaired cerebral circulation, hyponatremia, raise intracranial pressure, elderly hypothermia, monitor blood pressure and blood cyanide concentration. Also the blood thiocyanate concentration if given for more than 3 days. And this nitroprusside avoid in sudden withdrawals, reduce infusion over 50 to 30 minutes to avoid the rebound effects. And also this nitroprusside precautions in pregnancy and also in breastfeeding. So next we see the dosage of this nitroprusside. This is in hypertensive crisis, and these doses are available in intravenous infusion. So in adults, this intravenous infusion, adults initially 0.3 micrograms per kilogram per minute, usually maintains the dose 0.5 to 6 micrograms per kg per minute, and the maximum dose is 8 micrograms per kg per minute. And stop the infusion if response unsatisfactory after 10 minutes at maximum dose, and the lower dose in patients already being treated with the antihypertensives. So at last we see the some adverse effects, that means side effects of nitroprusside, and the adverse effects include the severe hypotension, retching, abdominal pain, perspiration, palpitations, apprehensions, retrosternal discomfort, rarely reduced platelet count, and acute transient phlebitis. So these are the adverse effects of nitroprusside. And last we see the diazoxide, and the general points about diazoxides are this diazoxide is non-diuretic thiazide, and this diazoxide administered by IV, that means intravenous route, and this is diazoxide is same as thiazide diuretics. Welcome students to our new YouTube channel Pharma X Tech.